Amazing. Okay. So Anita, start us off by telling us, speakers, listeners, watchers, where was it that you kind of started with your health, and where is that taking you? Because I know it's been not a very linear journey. And what have you learned along the way?
Okay, so for me, it started around about 15 years ago, when I started getting some symptoms that at the time I didn't realize were related to my thyroid. So symptoms like putting on weight, feeling very cold, tired, bowel movements had suddenly started to change, feeling tired, and it just suddenly happened. It wasn't overnight. Sorry, it was overnight, in fact. I remember coming back from Hawaii and suddenly thinking, that's strange. Just after this flight, feel like I'm holding a bit more water, more than usual. And then a week later, nothing kind of changed. And I thought, that's really weird. Put on about 5 kilos in the last week. That's really strange for me. And then I thought, okay, let's just go with it. Did my usual sort of back to normal, eating, exercising, and nothing was happening. It didn't help that we were going from October to November, so weather was getting colder, but I was feeling really cold compared to everybody else. Cut a long story short, all these symptoms started to add up, and I'd gone to see my GP. He said everything was fine. In fact, kind of sort of suggested that all of my symptoms were not really real. And I thought, they definitely are real, and I'm not going crazy. So then I went to see a nutritionist because she was working in the practice that I work at. So I'm a dentist by profession. And she looked at me, did a thorough history and assessment, and said, you know what, Anita, I think this might be something to do with your thyroid. You'll need to do a private blood test, but if that comes up with something, then we know that you've got something going on with your thyroid. So because of my symptoms being quite severe, I thought, yeah, I'm quite willing to go ahead and have a blood test done. My levels at the time were quite normal, but my antibodies are really high. And that was indicative of something called Hashimoto's, which is known, fairly well known as an autoimmune thyroid condition. I think something like the statistics are one in 10 people, particularly in the US, have, especially women, have a thyroid condition, and 25% of those have Hashimoto's. That was then when I'd sort of got this diagnosis on the blood test. I thought, great, I'll go to the doctor now and he'll say, oh, okay, yeah, got it now on black and white. And this means that it's this condition and therefore you need this medication. And then that was the end of it. That's what I thought would happen. Went to the GP, showed him my bloods, who basically poo-pooed them, said, that's not really the markers that we look at. And actually, some of the other markers, this particularly one was TSH, was in the normal range. So he's not going to treat me. There's nothing wrong with me. And the symptoms that I'm having, I should wear more clothes, I should exercise more, and I should eat less. So anyone who knows me, I know a thing or two about nutrition, and I was like really frustrated with this answer. So then that led me to go online. I found someone similar to yourself, actually, a patient advocate, Mary Shomon, and she had written books about thyroid, and that started my journey essentially. So I read into books, looked into alternative practitioners, how I could help heal myself through nutrition, diet, perhaps, what other things I could do, alternative medication, or potentially other things, supplements, nutrition that I could do to support my thyroid. And that's where the journey started, and still going today.
Wow. Well, I know that, yeah, when we first met, I thought that I'd done a lot and I'd seen a lot of different people and I'd explored a lot of different avenues. And then I felt like I had my tail between my legs for a long time. And I thought, wow, Anita's been there, she's done that, she knows a lot. You mentioned quite a lot about kind of nutrition and things. I mean, from the way I look at health nowadays, obviously there is, a huge scope for starting to look at health from a nutritional point of view, because as we know, the gut is like super important, and kind of feeds into like every other system in the body. So when people come and talk to you and they ask you about your experience and things, because there's a lot of hype out there, it's a real buzzword, it's really difficult to know who to trust and whether something's going to work for you. Can you explain to me, like, how have you navigated that? Like, have you ever started something and found out, it hasn't worked, or someone's made a recommendation and actually, you hadn't got along with the person? Can you talk me through that a little bit?
So obviously, having a scientific background, I do like to follow science, and I like to have some evidence. That for me, evidence doesn't necessarily have to mean a randomized controlled trial. It can often be just from word of mouth, from people that have tried and tested it themselves. But I do like to see if there are papers and if there are studies and things that have shown it, then that's just a bonus for me. So like going back sort of when I initially started, I didn't know a lot about the gut, and I didn't know its correlation to the rest of the body, or how important it was. And so when I first started hearing about these things, it would really be through patient groups. I would be part of various different forums, and I would read certain things about, for example, selenium being a nutrient that would be useful for lowering your antibodies, or to avoid gluten, because a lot of thyroid patients, or patients with thyroid disease, have often what's called a leaky gut. And so I would hear these things and I think, oh, okay, that sounds like quite intense what they're doing. But then interestingly, the more I would see it, the more I'd hear about it, and then I'd read an article, or I'd hear someone talking about it, and I think it used to then sort of just fall into place, and I'd say, okay, well, let me try it out. And for me particularly, I would say I can't admit that I'm 100% gluten-free, or I'd probably say 95, 99%. So I do prefer to avoid gluten, because for me, then I tried it out, and I felt better. So for me, trial and error. I would then look at, say, for example, I'd see it on a forum. I'd see how it would feel for me. Like there's something called the autoimmune paleo diet, where you would have to avoid vegetables like the nightshades. And that for me was like, whoa, I love tomatoes, I love peppers, I love aubergines, and I don't get any reactions. I don't think I'm going to do that yet. One day maybe I will, if it comes more and more into my field. But essentially, listening to other people, seeing how it sits with me, reading. Now on social media, I mean, constantly my feed is filled with one celebrity or another talking about the gut, this, that, and the other. And yeah, so for me, it just makes sense. If it makes sense, then I'll start doing it.
I really, really loved what you said about, evidence doesn't necessarily have to be, a test taken in controlled, conditions or whatever. Because that, I mean, if we talk about alternative health, generally, most people's block to that is, there isn't enough evidence for it, or there isn't any evidence for it. And it's, being a linguist, it made me start thinking, well, actually, how do we define the word evidence? Because obviously, as you say, there's scientific evidence, which is, which are proven results. But actually, it could also be someone's experience, as you say, talking to different people, finding out what's worked for them. Also, like testing it out on yourself and seeing how you respond. I find us fascinating as humans, because we like to know, that it's worked definitely in other people before we even try it in ourselves, not even contemplating the fact that we're a totally unique human being, set of cells and everything. So I thought that was a really, really kind of interesting point. And in terms of, I know you said at the beginning that your GP had kind of poo-pooed what you'd taken to him. How did that make you feel at the time? And what was your response? And then looking back on it now, would you have the same response? Would you do anything differently?
So at the time, I remember feeling extremely frustrated. I felt like, hang on a minute, I've now got the evidence that you were talking about, and why are you now saying that there's nothing wrong? It's clearly here on paper. And yeah, I felt really frustrated, but I knew I could feel it within myself. Something wasn't quite right. I knew I wasn't me. Something had changed. I just didn't know what it was. Probably, maybe can't call it a stubborn personality trait. It led me to do more research and do more reading, and not necessarily accept that prognosis for me or that diagnosis from the doctor. Would I do something different now? I really do encourage people to, I mean, the internet, the world is full of information. Sometimes it's difficult to navigate, but it's important to do your own research. And I can speak from my own experience. For example, nutrition in dental school, we're taught some nutrition, we're not taught a lot or a great deal, and so much more has evolved. And I mean, I qualified almost 20 years ago. Well, that sounds a lot, and so much has changed. And unless, like, your physician is regularly updated or really focused on this, they may not know, like, necessarily the up-to-date information. And so I would probably, now looking back at it, if I had the same result, I would go to my GP. I would say, these are the symptoms that I've got. I'd possibly try and maybe find some studies so that they were then educated, or show them some references, because obviously doctors like to work with scientific based information, and maybe that would help. Or I would just continue looking for a physician that was willing to listen to me. The beauty of social media is, I'd say it's a lot more in the States. You hear that there are physicians who are willing to listen to you. I would say slightly unfortunate, we're both from the UK, it's not necessarily always available on the NHS. So it does mean that you have to potentially go down the private route. But with information, with research, and with persistence, you should be able to find someone that should support you. So I think nowadays I'd probably just navigate towards someone that would listen to me, would help me.
Yeah, that's such a valid point. I think, as you say, you don't know until you started looking, and at that point there is an overabundance of information. That's fact. But it's about being able to, I guess, follow your intuition. As you said, you felt something was wrong in your body, and that was enough to be evidence for you that you could go and look elsewhere. And then also there's that part of us, I guess, that has to be somewhat discerning, because behind everything, I guess, there's an intention and a motive, and particularly if there's money involved. And I guess that's where speakers and watchers here might be thinking, well, the NHS will be totally impartial because it's not making any money from me, whereas actually this functional medicine doctor or this naturopath or whatever, their salary is coming out of my pocket, so it's in their interest to prescribe me all these things and and lead me down a certain path. Do you ever have that difficulty where you think actually is this really the right thing? Am I doing this for the right reason? What's their motive behind it, I guess? Does that ever factor in as a consideration when you're choosing who to go and work with?
Yeah, of course, definitely. I would say perhaps I have a slight advantage coming from a medical background, but as strange or not as this may sound, when I connect with someone and they take time to listen to me, and based on the questions that they're asking me, or the information that I'm sharing, or the suggestions that I'm making, you can usually figure out quite quickly who you can trust, who you have rapport with, and like who makes you feel positive, who makes you think, or who do you think, okay, this person I really trust, and I think this person I'm going to be on a good journey with, like I can consider working with them, because not everybody is going to be right for you. It's a process of finding. I would say also, I mean, the NHS is absolutely fantastic. Also working in the system, I'm totally aware of the lack of funding that's there, and sometimes given time constraints or just lack of facilities, lack of materials, lack of certain things, you can't as a clinician, as a physician, I couldn't necessarily provide the very best every single time to everyone that I wanted to, and so as much as it's impartial, then for me, obviously, my health was really, really important. So I decided I do want to go down the alternative route. I do want to go down to the private route. I'd like to invest my money in myself, in my health, because for me, I feel it pays in the long run. Yes, certainly going on your journey, finding who works with you, and kind of trusting that gut instinct, going back to the gut, trusting your intuition and thinking, okay, yes, this person, I really gel with this person. I'd like to work with this person. Do your research. Nowadays, there's testimonials. There's loads of success stories and things like that that you can read and see. So that would be my recommendation.
Thank you. I think that will land actually with a lot of people. I know it has for me, because I've, been a bit like you, I guess. I've invested in certain areas of my health, and kind of got, a year in, 2 years in or whatever, and thought, is this the right thing for me? And am I with the right person? And, that might be 1 or 2 years in. And then, even back at the beginning, sometimes it's like, how do I know that this is going to work? Because it's a huge amount of money for it to kind of go, potentially down the drain, or, for me not to get the results back. But I guess, I kind of really, really agree with you. Trust is so important. And that's not necessarily something that, you're going to read on a web page. That comes from a feeling. And it comes also from practice, I think, of being able to go out there and ultimately know what you want and know what's right for you. So one of the things actually that I wanted to ask you about was particularly to do with diets. I mean, you've mentioned one of the paleo diets, I think. You mentioned the word gluten. I probably about 2 or 3 years ago, if anything mentioned those sorts of buzzwords, I'd have jumped on it. I'd have been like, I need to read this. And then I started seeing them everywhere. And then diets became trendy, and, it felt like it was difficult to tell whether or not it was going to have, the effect that I wanted for me. So if, someone came to you and they said, there's this diet, I've tried this doesn't work. Have you read up about this? I mean, would you actually push someone towards necessarily a specific diet? Is there anything that that generally works for everybody, or do you think it's more a case of actually the individual has to be, I guess, what's the word I'm looking for? Quite kind of exploratory in terms of, looking for what's right for them, or do you know of any kind of, very general? I mean, you mentioned a couple of supplements before, like selenium, and that's everywhere at the moment. Like, are there general things which do just work for the human population, or is it very much more a personalized approach?
As cliche as it sounds, everyone is different. So, and one size fits all. So I wouldn't blanket say, if someone said to me, oh, what do you think I could do? Which diet could I follow? I guess it would depend on what's your goal. What are you looking for? What issues are you having? What potential diagnosis have you got? I would say generally some things just make common sense. So, for example, vitamin D. I mean, now we're having summer, and thank you, beautiful sunshine. But inherently, as a population, we all have, or it's very common to have very low vitamin D levels. So, and that's so important for many enzymatic processes, many processes in our body. So, for example, I might say to someone, check out your vitamin D levels, specifically to thyroid. So if I knew that someone had an autoimmune condition, or if they were having specifically a thyroid condition, I definitely recommend to avoid gluten. Dairy, sugar, corn, soy, for example, those are like very, I would say, common, I'm going to say dietary pollutants, and I don't mean to say that they pollute your body as such, but they can cause inflammation, certainly in an overload. And often when we have a diagnosis, a disease, there's something that's not quite in rhythm in our bodies, and something is slightly out of whack. So, and the things that kind of push towards inflammation, so bringing your body out of balance, are what I've just mentioned. So gluten, dairy, corn, sugar, soy. So I would then perhaps look to suggest eliminating those from your diet, ideally, say, for example, 30 days, and then start reintroducing or see how you are, reassess. That's another really important thing, is to, when you're trying out something, is try it out, assess it, take stock, say, how am I feeling? Is this good for me? Is this cost effective? Can I keep going? Is it maintainable? Then if it is, then go for it. And if it's not, then you've got to find something else that works for you, because not everything's going to work for everybody. With regards to the diet, it really depends on your hormone status. It depends. There's lots of different things. So I wouldn't say follow a particular diet. If you're someone that really hasn't got a clue of where to start and it's all overwhelming, then maybe, yes, you could follow, for example, the keto diet or a modified keto diet. I know particularly for women, that's slightly better. And if you've got a thyroid issue, not all the types of interval fasting are the best for you. You shouldn't fast for too long, not to put too much stress on your body. The autoimmune paleo diet, if you're someone that needs complete sort of rules and regulations and it needs to be guided properly, then yeah, go for it. But I would say potentially try it out, test it, see how it works for you. If it's cool, go for it. If you can still enjoy life, then do it. And if not, then find whatever works for you. And I think that's what I've done over the years. So I've definitely been guilty of trying all sorts of diets and formulas and potions and all sorts. And now I just kind of work for me. Pretty much follow the sort of 80-20 rule. So 80% of the time I'll be really strict with what comes in, and then 20% of the time within reason. Yeah, I'll let my hair down a bit.
I think that's a really lovely point you make, because it's very easy to become, I guess, fixated on, these kind of practices and measures we put in place, and all in the name of having the best health possible, forgetting that actually life is about enjoying ourselves. And of course, it's really nice to be able to let go. And I hate using expressions like treat yourself or whatever, because I don't think there's necessarily such a healthy psychology behind it. But ultimately to not kind of make our lives really unenjoyable because we think it's going to help our health in the long term. And that made me think about, is there anything actually that's less kind of, even maybe less more alternative than diet, than supplements, all this sort of thing? Is there anything that actually comes from much deeper within that you've experienced that has had, you think, maybe an effect on your thyroid?
Yeah, definitely. So I think I first came across this let's call it theory when I was listening to something from Gabor Mate, and that was to do with autoimmune conditions being the result of unhealed trauma. So that's to say, you experience something in your life, perhaps you haven't dealt with it, perhaps you haven't really kind of processed the emotions, or your body is still storing onto that trauma, or there is still a memory within your body, and that as it stacks over time can then manifest as an autoimmune condition. The body is powerful at kind of protecting itself, but at the same time reacts obviously to trauma. And I was already sort of within our culture, coming from an Asian background, religion, the spiritual world wasn't new for me. But this kind of the connection of the mind and the body and the spirit. It's all one. And fortunately, I was introduced to the world of meditation. We both know each other from there too. Also yoga. So yoga and meditation are different forms of healing modalities. And I think that's equally as important as the nutrition, the mind and the body stuff is just as important. So meditating, so taking some time for yourself. I mean, physiologically, just breathing really well. So just deep diaphragmatic breaths can have a profound effect on your physiology. Ensuring that your brain goes into a restful sleep. Yoga, particularly for the thyroid, there's certain poses that can encourage blood flow. So the thyroid being in the throat chakra area, an example is a shoulder stand. So when we do that, we compress the thyroid, or fish pose, for example, you're constricting or restricting the blood flow to the area. And then over time, you're encouraging fresh blood to go to that area. And, you know, blood is like the oxygen of life. So that's really important. I'm sure that's had beneficial effects on my thyroid too.
My goodness me. It sounds honestly fascinating. Yeah, I often refer to you as my encyclopedia friend, because any topic of health that I want to know about, I always come to you, and you seem like you've kind of, you know a lot. Anyway, I've actually kept you over time, but no, this has been so interesting, and I know that people watching back or listening back are probably going to be, taking away a lot of nuggets of wisdom. They'll probably have more questions, and I know that you'll have kind of given glimpses into certain areas that maybe people haven't thought about either. And obviously the similarity of, your thyroid condition with MEN1, we have issues around our parathyroids. And I think the fact that they are so close together, it just makes me think, well, what are the similarities, what are the similarities and what are the differences? And, is there stuff that we can kind of draw on from one another? So anyway, I'm not going to jabber on, but I'm going to say thank you so much for giving up your time. And I'm pretty excited, hopefully, to have you back again sometime.
Sure, it's been great. Thank you.